WRSR, Owasso, Flint. The following program has been pre-recorded and is paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc. Welcome to Discover Flint Township, a program showcasing our local community. Flint Township is ready for your next move. And now, your host, Flint Township Economic Enhancement Director, Tracy Tucker.
I'm Tracy Tucker, and this is Discover Flint Township, brought to you by the Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, Shea Automotive Group, and 103.9 The Fox. This morning, we will be speaking with Bridget, Hollingsworth, Stafford from HAP, and we'll also shine our guaranteed rate business spotlight on Michigan Vascular Center. But let's get started with Bridget. For those of you who haven't listened to our show before, Bridget is the Director of Marketing and Community Outreach for HAP in their Mid-Michigan market. Hey, Bridget, how you doing?
Great. How you doing?
I'm good.
Good.
So I understand that today this is an all men's health awareness month,
right?
I think, right?
Yeah.
So we're going to talk about trying to get that guy of yours or for you men out there, to get in and make sure you're taking care of your health. So
Absolutely. June is Men's Health Awareness Month, and so we want to focus on that and get folks in to see their doctor and to get all the tests and all the screenings that are so important to get.
Sure. So, it's really... guys are really not the best about going to the doctor.
No, they're not. Historically, you'll hear guys saying it's really true that men seem to be more hesitant to go to see the doctor when something is wrong or they think something is wrong. And they're also not as likely as women to get those preventive screenings and get their checkups. And that's kind of scary because, we've talked about this before, but early detection of medical issues is really the best way to improve their condition and to make sure that the treatment and management of that issue is handled as best as possible. And it really is an important topic, and that's why the month of June is dedicated to men's health awareness.
All right. So make sure you're listening in for the next few minutes. If you don't plan on staying for the whole show, at least get the next few minutes because
for sure.
This is very important. You're going to kind of go over with us what screenings that men should be sure to get at certain age groups, right?
Right. So to start out with, if you're in your 20s or 30s, this is really a time when you need to start thinking about having an ongoing relationship with a primary care physician, and that's family practice, internal medicine, someone who can handle your overall health. They'll be able to send you to specialists if need be and so forth, but really having a trusted health professional who knows you, knows your history, knows what's going on with you, and can talk to you about health concerns really makes it easier to stay on top of all that stuff that you need to do. So at this stage in your life, the 20s and 30s, you really need to start looking at biometric screenings and early detection of certain things. And so some important aspects of that, vaccinations, that's been a huge topic of conversation. An annual flu shot, super important. A tetanus booster you need every 10 years. And I'm going to say it again, if you haven't gotten your COVID-19 vaccine yet, now would be a great time to do that.
Yeah, and tetanus, that's very important, especially like if you're in the construction field or something like that. I have had friends who have passed away from being injured and they didn't have their tetanus shots and stuff, and they were in the construction industry. So make sure you're getting that.
Yeah, it's very important. A few other things you want to start looking at in your 20s, your blood pressure, your cholesterol level, and also diabetes screening. Diabetes is so prevalent in our community, and it's something where lifestyle factors and family history can increase your risk. So you definitely want to start checking that out around that age. You also want to start doing an annual skin check. Have your doctor look at your skin yourself for moles or any changes, some things that might dictate skin cancer or other types of conditions that need to be managed. And it's also time to start looking at depression screening. Depression is a huge issue and a problem. So those are the types of things that your doctor's going to recommend when you're in your 20s and 30s. And it really sets the foundation for the future cancer and the things that you need to be thinking about to stay as healthy as you possibly can.
Right. And one of the biggest things is just make sure you have a doctor that you trust and that you start seeing them at least once a year.
Exactly.
Right?
It's really important to have that relationship. Again, having somebody who's sort of the hub of the wheel, if you will, that kind of helps coordinate everything that you're doing and knows about all the different conditions you have and is able to kind of help direct you to the services that are going to be most beneficial for you. And once you get up a little bit into, the 40s and 50s, of course, the things we talked about before are still important, but this is when you start to see the increase in risk factors for things like heart disease and diabetes. And some men also may notice that their blood pressure is getting a little bit higher around this age, and they're seeing weight gain because their metabolism is slowing down a little bit. So a few of the things that should happen in the 40s and 50s, it's no fun, but it's really important. Colon cancer screenings.
Yeah.
So, whether some of those can be simple tests, others can be a colonoscopy. You'll, again, get some guidance from your doctor, but you need to have those every 10 years, starting around age 45. You also want to talk to your doctor about having a prostate cancer test. It's really important, and your doctor can help you determine if a PSA test is good for you to have. And another thing you want to start looking at more closely in the 40s and 50s is your eye exams. You want to get screened for glaucoma at least every 1 to 3 years. So at this stage, it's also really important to focus on heart health, and that means paying more attention to your diet, being more active, and trying to maintain a healthy weight. So those are some focus for your 40s and 50s.
Yeah, and you're not saying you have to get a colon screening every year. I mean,
No.
it's every
Right.
every 10 years. So get
Yeah.
it done, get it out of the way,
Exactly.
and set your calendar for 10
yes.
years down the road.
Yep, and your doctor can help remind you. I've experienced that myself. So, and then, as you get up into your 60s and so, really, this is when we need to continue looking at those physical things, but staying mentally active is super important for your overall health and well-being. So men's screening at around 60 and up should include all of the things we've talked about before, but you also want to start looking at a few other things. You want to talk to your doctor about some of these things and get their guidance on how often they should be screened, but some things you want to look at, make sure you're adding a pneumonia shot in your 60s, and pay a little bit more attention to your brain health. Your doctor may do some memory tests or other kind of tests to help, measure and keep track of your brain health. Mental health screenings are still really important, and this age is around when we start to see some hearing deterioration as well. So that would be something your doctor might add to your overall screenings when you're around 60 or so.
Yeah. And we're going to talk a little bit more about this, but before we do, I will remind everybody, I am not a doctor.
Neither am I.
We do have a doctor on later in the show,
Yes.
but I am not. So if you have a question on any of these things, please go to your physician. So, but we will talk about this a little bit more. So, brain health and memory test, mental health screenings, hearing tests.
Yeah.
So those are a little bit different. They may have to do with colon exam and those types of screenings as well. Basically, getting into your doctor is the first step.
Oh my gosh, that's so important, Tracy.
Quit worrying about what it is you need to go to him for, because if you should do an annual exam, right?
Correct.
Every year.
For sure. Everyone needs to see their doctor at least once a year.
Yeah.
And don't brag about how long it's been since you've seen your doctor. That's horrible. I hate to hear that. But some things you really want to do, make sure you're scheduling these recommended screenings, by or around the ages that we've talked about. It really can help identify health issues before symptoms appear, and it could help detect conditions really in the early stages when it's much easier to treat. It's much less invasive. It's much less inconvenience for you, too.
Right. And if you have an issue, you need to tell the doctor what it is.
They've heard it
not
all.
a mind reader.
I talk to a lot of doctors. They've heard everything. So don't be afraid to talk to your doctor.
But I love they should know what's wrong. Well, my husband had.
They're not magicians.
My husband said, if they wanted a patient who wasn't able to communicate with them what their symptoms were and what was wrong, they'd be a veterinarian.
Exactly. Although they say the animals are, you can translate them too. I have an app that translates what my cats say.
Oh, that's funny.
Yeah. I don't know if it's true or not.
But yeah, definitely tell your doctor if there's anything weird going on in your health or anything like that.
You're going to want to talk about your lifestyle, your diet, and be honest. Like I said, they've heard it all. They're not going to judge. No, you want to talk about your family history, any of the health-related topics that are going on with you or your family. And you do, like I say, make it a priority. A lot of people do, we've talked about before, New Year's resolutions. Even if one of the things you do at the beginning of the year is say, okay, when is my checkup or my wellness exam or my whatever you want to call it? Let me make sure I have that scheduled. Make that something that you do every year without fail. It's so, so important.
Yeah, and a lot of the insurance companies pay for that.
Oh my gosh,
right? So why
preventive care is covered, and that was under the Health Care Reform Act, and Obamacare kind of helped to make that where you should not have to pay anything for services that your provider bills as a preventive service.
Sure.
Certain ones might require that it's done within certain periods of time, but ultimately you should not have any cost associated with your preventive care.
No excuses.
Exactly. So reconsider the reasons why you haven't been to your doctor. Please take a second, think about yourself and your family, and really talk to your team about some potentially life-saving screenings. I mean, some of these things are really simple to do, but they're so important to do. And again, I'm going to say it one more time, probably more than one. Get your COVID-19 vaccination if you haven't already. There are lots of opportunities around Genesee County and the area to do that. Please, please, please get your COVID-19 vaccination.
Yeah, we talked to Pastor Prince from Central Church of the Nazarene, which is in Flint Township, but they're still doing the vaccinations there every Wednesday if anybody wants to come. I think they're doing walk-ups as well now.
Yep.
I mean, but go to the Genesee County Health Department website and you can
GC
schedule.
for me.
GC for me.
GC for me.
Yep.
And because men's health is so important, we're doing some events this month. Some of them are targeted to our Medicaid members, but really the information we're going to be sharing is appropriate for everybody. So you could visit our website at hap.org to get more information. But we have some events coming up on June 17th and June 19th, and we've got a whole host of experts to help answer questions and provide information. We're doing some in-person activities around Detroit, and we're doing so folks up here could access us via Zoom or WebEx. And so visit our website, hap.org, get more info, get in and get your care, men.
Yeah, there you go. So, wow. This has been an exciting show. We talked about so many things. I'm trying to think what else was there I wanted to bring up. I mean, the men's health is so important, and I am
maybe we need to tell the women
about going. We need to
do
the women's one too because I know I'm bad, but my husband's worse. So we had to do the men's health one now. Yeah. So Men's Health Awareness Month. Make sure you talk to your guy and get him to do this. Or if you are a guy and you're listening, you need to get in and talk to your health provider.
Please don't put it off. Please see your doctor.
Yeah, we'd like to keep our listeners healthy.
Right. We need all of you.
Yeah, we need all of you. So I guess that's it for this month, huh?
Thanks, Trace.
It's so nice having you here.
Thank you very much.
I'm trying to think if we have anything coming up, but Bridget will be back again next month, and she is from HAP Empowered.
Right. HAP Empowered is our Medicaid brand, and we're thrilled to have so many members here in the greater Flint area, and we're happy to serve all of our members. So again, hap.org is an awesome place to start for all kinds of information, and HAP is here for you. So.
All right. Awesome. Well, thanks for coming in. And coming up next, we are going to have our Guaranteed Rate Business Spotlight with Michigan Vascular Center. So we'll see you again next month.
All right. Thanks, Tracy.
Right, bye. We want to do a special thanks to all our sponsors: Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, Shea Automotive Group, and 103.9 The Fox. I would like to remind our listeners that if you have any questions, you can contact us at discoverflinttownship@gmail.com. or visit us on Facebook at Flint Township Events, FLINTTWPEVENTS. You can go to our YouTube channel, Discover Flint Township, or visit our web pages, discoverflinttownship.com or flinttownship.org. I want to thank our guests today, Bridget from HAP and Dr. Matos from Michigan Vascular Center. And thanks to our partners, HAP, Shea Automotive Group, Financial Plus Credit Union, Guaranteed Rate, and 103.9 The Fox. Discover Flint Township with us next Sunday at 7:30 a.m. This is Tracy Tucker, the Flint Township Economic Enhancement Director, and I would like to remind everyone, stay safe, stay healthy, shop local, buy local, and discover Flint Township. See you later.
This has been Discover Flint Township with Tracy Tucker. For more information, visit discoverflinttownship.com. Flint Township is ready for your next move. The preceding program was pre-recorded and was paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc.